Hello, my name is Bill Burdick, Secretary General of TUFH, the Network Towards Unity for Health, and one of the educators in the TUFH Academies. The TUFH Academies play an important role in facilitating global learning for students, faculty, policymakers, and institutional leadership within their health ecosystems. Our TUFH Academies value application of knowledge and learning with and from each other. We use a combination of short lectures and small group discussions and encourage development of locally authentic projects that apply knowledge to participants' local environment and their community. We offer courses with live sessions as well as those that can be completed at an individual pace. We recognize that students, faculty, and institutional leadership have diverse but complementary learning needs and interests. That's why we organize our TUFH Academies into leadership, faculty, and student tracks. TUFH's mission of equitable access to care drives the focus of TUFH Academies towards better serving the globe's most vulnerable communities. We have 6 themes in our Vulnerable Communities track: Indigenous, Migrant and Refugee, Remote and Rural, Aging, Complex Care for Intellectual and Developmentally Delayed, and Women Populations. The leadership track, organized within the framework of a fellowship, includes modules on social accountability related to institutional responsiveness to people and societal needs, community-centered engagement and design for impact, promoting institutional change that engages faculty, students, and community in the design and creation process, policy design and social behavior, a framework to engage with the legislative process for system and policy change, and educational, leadership, and organizational change, teaching a process that brings the entire community together to envision and make change. Our faculty track has 4 connected courses: social accountability, appreciative inquiry, interprofessional education and team-based care, and transformative leadership. Continuous development of a project across the 4 courses applies concepts in problem identification, change management, stakeholder engagement, and program evaluation. We offer 3 student courses intended to fill potential gaps in their health professions education curriculum: communication, extended beyond patient interaction to talking with partners and communities; social determinants of health, with a strong emphasis on each student's environment; and innovative cities and health, connecting climate change, water management, social well-being, and other issues with cutting-edge solutions. Together, the vulnerable communities, leadership, faculty, and student courses encompass key elements of systems that promote a comprehensive approach to wellness.